Signs and symptoms of a heart attack are very important for the community to know. There is that crushing chest pain, there is sometimes jaw pain, there is sometimes just a feeling of not feeling well, nausea, and a lot of times for women, those signs and symptoms can be different. So if a woman is experiencing nausea, back pain, jaw pain, pain down their left arm, those are signs and symptoms of a heart attack.
When you're having a heart attack, every minute matters, and sometimes 2 or 3 or 4 minutes is the difference between going home to be with your family and not going home at all. And now that we have the facilities here that we have, patients in our community get treated much more quickly than what they used to a little over 20 years ago. In addition, our state has been very proactive in trying to shorten the amount of time between when someone has a heart attack and when they get the care that they need. And it's a program I think we can all be very proud of. The state calls it the RACE program, and it has to do with getting people to the emergency room as quickly as we possibly can. They even use NASCAR as a little model for it, but it has to do with very, very quick therapy for people having heart attacks, because that time can make the difference between a good outcome and a not good outcome.
That's why it's important that if someone thinks they might be having a heart attack, is to call 911 and activate that system very early.
It involves a lot of people. It involves the ambulance teams, the EMTs. They get EKGs out at the patient's home. They can transmit those EKGs to the hospital.
And I get to see that EKG the minute the EMT takes that EKG in patient's home.
Now with the technology, we can transmit that electrocardiogram. It'll come across on my cell phone. They take a picture of it. You can have a whole text message tell you what's going on. You can look at it on the way to the hospital and see, you're right, this is a STMI. I'll be there in 7 minutes.
So you're talking about within 10 minutes of somebody calling in 911, the cath lab is activated. That means everybody on call for the cath lab, including the doctor, the ancillary personnel, the technicians, the nurses, they're all getting beeped at the same time.
The cath lab is where most of the technology and most of the excitement is. That's where we put catheters in through a blood vessel, put them up into the patient's heart, and put little wires and balloons and stents and other devices into the artery to open it back up, restore the blood flow, and make the heart attack stop.
One time I have 3 patients back to back, and we take care of them within 20 minutes each. That shows how we are extremely capable of taking those patients with the heart attack.
The bottom line about heart and vascular problems, that includes the 2 major things, heart attacks and strokes, the 2 major killers in the country. When you get one of those in the middle of the night, you have to go to the nearest hospital, which gets you the best care, that you don't have to go anywhere else. And Cape Fear Valley Heart and Vascular Center has all the personal expertise and technology to take care of patients who come with heart attack and strokes.